For most of us, a hug or a simple handshake is just a normal part of life, a way we connect. But what if it felt like a threat? Today, we're going to dive into haphephobia. It's an intense and often really debilitating fear of being touched. So let's get into what it is, where it comes from, and how it can be managed.
So here's how we're going to break it all down. First, we'll get a clear definition of what this fear actually is. Then, we'll dig into its possible roots. After that, we'll see how it really impacts daily life, and finally, we'll look at the path forward for those who are dealing with it.
Just think about that for a second. A gesture that's meant to show comfort, or friendship, or even love, suddenly feels dangerous. This one question really gets to the absolute heart of what it means to live with haphephobia, and it's right where our journey begins today. Okay, so let's shift gears from that emotional question to the more clinical side of things. What exactly is this specific and pretty powerful anxiety?
Right. And the thing you've got to understand here is that haphephobia isn't just, not liking physical contact. The definition is an intense and often irrational fear. And what makes it so challenging is that this fear isn't just about strangers. It can happen with anyone, even the people you love and trust the most.
Well, that naturally leads to the next big question, right? Where in the world does a fear like this even come from? So let's start digging into the roots of this phobia.
Well, the truth is, the origins aren't always straightforward. They can be incredibly personal. For some people, it's rooted in past trauma, almost like a mirror that's been shattered. For others, it might be more connected to this deep fear of their personal space being violated. And sometimes, it's all part of a bigger web of social anxiety and issues with trust. It's often a really complex mix of things.
Okay, so understanding the causes is one piece of the puzzle. But what does this fear actually look like in someone's life? How does it feel on the inside, and what do people see from the outside? Let's break that down.
You see, it's like a two-sided coin. On the inside, there's this storm of anxiety, that knot in your stomach, that feeling of panic when someone just gets a little too close. And that internal feeling, it drives the external behavior, actively avoiding things like handshakes or steering clear of crowds. And it's not just a feeling. The body can react physically too, with things like sweating, shaking, or a racing heart.
So, when you combine that internal anxiety with that external need to avoid things, wow, the ripple effects are huge. Let's take a look at the real-world impact this has on relationships and even the simplest everyday routines. And this really is the core challenge. The very thing that so often brings us comfort and makes our bonds stronger, human connection through touch, it becomes the primary source of anxiety and fear. It completely flips a fundamental part of our social lives right on its head. And this comparison makes it crystal clear. On one side, you have all these everyday social norms that most of us just don't think twice about, right? A handshake, a friendly hug, standing in line at a concert. But for someone with haphephobia, these are not simple interactions at all. They become events that require active avoidance and can cause some really intense distress. The gap between these two columns? Well, that's where the daily struggle is.
But, and this is so important, this is not a hopeless situation, not at all. And that brings us to our final and maybe our most constructive section, finding a path forward. Let's explore the ways people can learn to manage this fear.
The path to managing haphephobia usually follows a few key steps. The number one tool is therapy, especially something called cognitive behavioral therapy, or CBT. Basically, it helps people identify and then challenge the fearful thoughts they have about touch. This is often paired with gradual, safe exposure in a controlled setting. And on top of that, there are coping techniques like relaxation to manage anxiety in the moment. And yeah, in some severe cases, medication can also be part of the plan.
This quote really just captures the most important takeaway here. With the right kind of support, progress is absolutely possible. The goal is to reduce that fear and start to reclaim a sense of comfort and safety with physical contact.
So we'll end our explainer with this thought. Understanding a condition like haphephobia doesn't just give us some clinical knowledge. It actually challenges us to be a little more mindful. It makes you wonder, right? In a world that often just assumes physical touch is always welcome, how can we all get a little better at seeing and respecting the invisible boundaries of the people around us? It's something for all of us to think about.